so without any further ado, we have Mr. Rick Francis, one of the members of Game Changers, and Dell Williams over here. Dr. Dell is going to be talking about the Affordable Care Act. Rick Francis, he works in the pharmaceutical sales, and Dr. Dell is a psychiatrist over at Parkland Hospital. So they have an inside perspective of what's taking place. And they gave this presentation a couple months ago, but things have evolved in, so I'm quite sure they have some new information for us. So come on up, Rick Francis, give a hand.
Thank you very much. We're going to get set up here real quick and get the show on the road. How's everyone doing tonight?
Stay to your side.
Good, good. Well, hey, as Eugene mentioned, my name is Rick Francis. I'm a member of Game Changers, and I came here tonight to educate you. Hopefully, most of you are already educated on the healthcare issues that are impending as a result of Obamacare. But what I want to do is update you on some issues and kind of how this is going to play out from a ground level perspective. And I've been in the healthcare industry almost 12 years, and I've been in the community healthcare setting and the private healthcare setting. I've sold products and items to private practice doctors, as well as Medicare, Medicaid doctors, long-term care facilities. So I'm pretty aware and up to speed on a lot of things that are happening before they begin to bubble and manifest to the surface. So what I want to share with you tonight is some information on the Affordable Health Care Act, aka Obamacare's impact on our lives. Let's talk about the real story behind healthcare. A lot of people think that this idea is something new or it's a surprise, but it really isn't. It's been a vision of the left for a very long time. And, you know, I asked the question, what are the true intentions of the Patient Protection and Affordable Health Care Act? Well, I submit to you, instead of me telling you about it, I'll let you hear it in their own words or in his own words.
America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately. Because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
So there you hear it in his own words. So when everyone starts talking about what are the true intentions of healthcare, I submit to you that he's already told us. This was when he was then Senator Obama, talked about what his vision was for healthcare, and he said it's a single-payer system. So let's talk about the truth behind the numbers that they bandied back and forth for a long time. The 47 million, the 33 million, the 31 million, and take a look at the breakdown of the 47 million uninsured. As you can see, here, as you look at the breakdown, in reality, those eligible for government programs, 9.7 million at the bottom. There's a pointer on this, right?
Yeah, this is breaking.
The middle? Okay, there we go. So that 9.7 million, eligible for employer-sponsored insurance, 6 million. Americans without affordable options, 12 million. Look at this, individuals earning more than 75,000, 9 million people that have just elected not to have health care insurance. It's not because they can't afford it, it's just that maybe their Lexus or their, $400,000 or $500,000 home or whatever is worth more to them than the health care option. So they've elected not to have health care. So we actually have changed and made an impact to the system based on a very small majority or minority of people. Now, they actually promised us a couple of things. If you like your doctor, you're going to be able to keep them. There's not going to be any major changes to your costs. In fact, your costs are going to go down. Insurers told us that pre-existing coverage for you and your child will be available. So all those things, all those promises were made to us, and a lot of the senators and our elected officials made their decision on approving the Affordable Health Care Act based on these promises. Many promises are made, but there's a lot of them that will be broken. And by the end of President Obama's first term, the actual cost of $3,000 higher per family, about $5,500 per family, than they were when they were initially implemented, before they were initially implemented. So the cost is going up, and I'm sure many of you see that now. How many of you are on Medicare? Anybody? Medicaid? Anyone? How many have seen your health care bills go down? How many have seen them go up? Most people, when they see a disaster, they change directions. But for some unforeseen reason, these folks on the left tend to, when they see a disaster, instead of changing directions, they put their foot on the gas pedal, double down, and go faster. And that's what's happening. We're heading for a impending disaster. The CEO of Aetna, the country's third largest health insurer, said we're going to see some markets go up by as much as 100% in his annual investor conference in New York just this year. Nancy Pelosi shared with us, here's an interesting fact that Nancy Pelosi shared with us prior to the implementation or the passage of the Health Care Act, and I'm sure most of you guys remember this. One of those
But we
moments
have
in
to
history.
pass the bill so that you can find out what is in it away from the fog of the controversy.
So we're finding out about it now, and what we're seeing is we don't like what we're finding out about this health care bill. Here are a few facts. Obamacare was passed by a Democratic majority. Most of you know that. More citizens oppose it than support it. The union support for health care is dropping, and in fact, the Longshoremen's Union recently, 40,000 members strong, dropped out of the SEIU, the AFL-CIO, because of Obamacare. And there are many more that are dropping that we're not hearing about, but everyone's starting to figure out what a catastrophe this law is, and they're starting to prod at it. And they're saying, you know what, we need to change this thing, or we need to get a exemption or a waiver. 42% of Americans are unaware that Obamacare has been implemented. In fact, how many of you know that if you do not have health care now, that you need to sign up for an exchange or in the health care exchange by October 1st of this year or be penalized? Is there anyone that didn't know that? Okay, so, everyone knows that this thing is coming. There's no stopping it. The train is pulled out of the station. We also heard about the Independent Payment Advisory Board. I don't know how many of you know about that, but their job is to make recommendations based upon the best treatment options for certain conditions. So I don't know if many of you know how the healthcare industry works, but usually what happens is innovation takes place in a small vacuum, and then it's tried out on a small majority of patients that can afford the procedures. As the procedures become more widespread and more people elect to have them, it drives down the cost, and that's how innovation begins and how we improve our healthcare system. Now, how many of you would like to take the same painkiller that you were taking 20 years ago? how many of you would like to have the same knee or hip surgery that was available 20 years ago? Today, you may have had the best surgery and the best medication that you will ever have in your life as a result of Obamacare. Because innovation is going to begin to wane. It's going to have an impact on what we're doing in the marketplace. Everyone's costs are going to escalate. Everyone who applies has to be accepted. Serious medical conditions, they have to be accepted. There are insurance mandates, and there's guaranteed insurance. There's all kind of things that they sold us, but they told us there wasn't going to be a charge. But many people are finding out that there is a significant charge and a significant impact on their health care costs. In fact, I had a conversation with my father the other day. He's a 35-year veteran, U.S. military, TRICARE. He was getting most of his medications for free, and he went to the pharmacy to get a new prescription for his blood pressure, and he had to pay $42. And before, he was only paying $5. So I tried to tell him, well, you know, Dad, this is what I told you about. This is what I told you the impact of Obamacare would be. And I submit to most of you that most of the people that were hearing about Obamacare and supporting it did not think it was going to impact them. And now that it is, wake up call. They're acting like Scooby-Doo, you know. So, you know, this thing is real, and it's coming whether they like it or not. Small employers will see a significant increase in their health care insurance. So if you're a small employee, you're going to be impacted as well. Of course, you know, they're going to play the blame game, and they're going to say health insurers are greedy, doctors are greedy. Some believe health care should not be run by big business. You know, I've talked to a very limited few of my physicians, and I've asked them about health care. And they've told me that they don't believe you should make money on providing services in health care to people. So I asked them, were you in support of slavery? And he looked at me all funny. Well, what do you mean? I said, well, slavery is compelling somebody to work without getting paid or reimbursed for their services. Basically, you're asking your physicians that have went through 20 years of training to work for free and not get anything for it. And that's what we're going to find out as I go on with the talk about the Medicaid system, because it's especially onerous. Medicaid right now is for people that cannot afford health care or have a disability. And it is a supplemental program for those people. All the health care exchanges is an expansion of the Medicaid. And just because you have insurance, just because you have a card that says, I have insurance, doesn't mean that doctor has to take you in his office. I started seeing this trend about probably 10 years ago when I was going into doctors' offices and asking them about Medicaid. And they were telling me that, you know, Rick, I really love to treat those patients. They are patients that are in need, and they do need our services. But for every patient I see, I lose $50 because of the reimbursement. And I said, well, what do you mean? They said, well, you know, my visitation fee is, say, $75. Well, Medicaid pays me $25. So I lose money on that. When I do a certain procedure or certain, you know, diagnosis code, you know, the reimbursement rates on that are lower. So he just kind of went on explaining to me about the impact of Medicaid, and it finally began to dawn on me why a lot of doctors limit their Medicaid patients in their practice to about maybe 20% or lower. And I submit to you that that number is going to start getting lower because the reimbursement rates are going to be cut even more. So here's just some other information about the impact of Obamacare. How many of you knew that on October 1st, any business with at least one employee an employee that makes over $500,000 in annual revenue must notify their employee by letter about the Affordable Health Care Act, its changes, or face a penalty of $100 per day. How many of you knew that? In fact, I submit to you, most people don't know that. I just learned about this recently because they've been making so many changes with the Health Care Act, it's hard to stay up to speed with what's going on. But this has serious implications for the small businessmen because most of them are probably not informed about this, and it may or may not be levied. I guess it depends on how they feel that day. So anyway, that was something that I thought was pretty interesting. Businesses with 50 full-time employees are required to offer health insurance. That mandate has been delayed, but if they don't, eventually there's a fine of at least $2,000 per employee. And what this does is result in a decrease in the full-time employment. So what they basically did is they said your full-time employee is 30 hours. So guess what the companies did? They went back and they started cutting all their full-time employees to 30 hours, or 29 hours actually. And so what you're seeing now is a bunch of young folks that can't enter into the workforce and get a full-time job because they don't want to pay the health care costs. They say there's an exchange available. We're going to let them know about the exchange, and that's how we're going to supplement their health care costs. So it's no more an advantage, no longer an advantage to those that are entering the workforce. Question?
What is CEO?
Okay, so the Congressional Budget Office is the one that puts all these numbers together, and this is where I got a lot of this data. But they estimate 7 million will lose jobs based on health insurance. In fact, it's going to be much more than that, and we know based on the unemployment numbers and the number of people dropping out of the labor force that it's going to be particularly onerous. I think they said there's 90 million people that are not working in the U.S., that the unemployment rate or the number of unemployed is the highest it's been in 35 years. So, I mean, you start levying more costs on business, you start mandating more health insurance costs, all of a sudden businesses start cutting and trimming back more. That's just the way it works. The companies, there's going to be an impact on the companies. Drugs and medical device companies will pay more in additional taxes. Your health insurance company that you have is not allowed to make more than 15% profit off of your premiums. So if I pay $100, that healthcare company has to pay or spend $80 to $85 on my healthcare services, or they owe me a rebate. And of course, they're finding ways around that, but that's why we're seeing an increase in premiums. If you're a new healthcare company and you're trying to get into the business, usually you're offering a limited amount of services. They may be a little higher, but as they get more people into the health insurance plan, they begin to lower the rates based on the health of the patients or the population. They also lower the rates. Well, they can no longer do that now. There's no room for them to negotiate or to change that. So that's why you're seeing the rates go up, because if everyone in here is healthy, and we got 4 people that are terminally ill, we know data shows us that about 85% of your healthcare dollars are spent during the last stages of life. So your last 10 to 15 years. That's when the majority of healthcare costs are spent. So before you'd be able to be placed into a high-risk pool where you would pay a little bit more, now everybody's going to be paying more to pay for those that are terminally ill. So, you know, I'm not one to sit up here and tell you that we didn't need changes to the healthcare system, because there were some changes that needed to be made. We needed to make some adjustments to make it more affordable for those who didn't or couldn't afford it. We needed to make sure that people were getting care that didn't need it. But there are so many programs out there now that people are just unaware of, that we did not need to make a wholesale change to the whole healthcare system to provide services for the 10 to 15% that did not have health care. Medical insurance, there are two types. There are individual plans and group plans. The group plans are provided by an association or an employer. These were started during World War II. This is, I guess, during FDR, he had wage and price controls on businesses. And so what businesses did is, in order to attract good quality candidates to the workforce, they started offering them health care. And that was one of the ways that they were able to attract high quality candidates into their jobs. So World War II is when the healthcare system started, the group plans. The employers and employees, they had a win-win scenario with this condition, and it was good for everyone. It was something that they offered as an addendum. It wasn't a mandate. It wasn't until later that the government came and mandated it. The annual premiums for employer-sponsored plans under the new bill, under the new Obamacare that's coming out, cheapest plan for a family of 4 or 5 will cost about $20,000 a year by 2016. Now, I don't know how many of you pay taxes. I did. But on your W-2 form, there's a new line item, and it has your medical benefits. How many of you noticed that this year? If you have or are in a group health plan or a company-sponsored health care plan, it has the number that your health care plan is worth, or the price that it's worth. Some is $25,000, some $30,000. Well, what's going to happen is they're going to start taxing you on the percentage that is above the baseline health care bill or the health care plan. So, for instance, this $20,000 is the baseline for a family of 4. If your plan is worth $30,000, they're going to tax you on the $10,000 over and above that plan in addition to your other taxes. So a lot of taxes there. Question?
This may sound off key, Rick, but are there any hospitals who would try to get into the health plan, because since all the facilities and doctors, most of everything is running through a hospital, are there any hospitals thinking about, hey, let us step in and be a health care provider since we are the doctors in the facility? Is there anything out there like that that's coming about?
And that's a very good question, Princeton. I'm going to table that because I believe Dr. Williams will be able to answer that for you. And he's in the community health care system, so he can speak to that a lot more than I can. Individual plans, we know individual plans are available. They're obtained directly from an insurance company. If you have it on your own business, you can go out and borrow to get your own benefit plan. And 2005 study indicated healthcare costs were the main cause of bankruptcy. Up to 1 million middle-class families filed bankruptcy due to medical bills. Many had healthcare insurance, but were not properly or adequately insured. So, just because you have health care insurance, it doesn't mean that it covers everything. And then you meet a dollar limit, and then all of a sudden you're paying for the rest of it out of pocket. So that's what happens to a lot of people. And really, we could have did a lot more to educate people on the health care services that they needed to make sure that they were adequately covered, rather than changing the whole system as well. But we didn't do that. So we're spending a lot of money on trying to fix things that are actually going to get worse. Healthcare exchanges, I think everyone has heard and knows about these, but they're going to have 3 different plans, a bronze, silver, and a gold. Each one is going to offer a different set of benefits, each one at a different rate. You can go on TexasHealthcare.com or .org, and it will tell you about the exchanges that you're eligible for if you don't have health care services, and it kind of walks you through a checklist. I tried to do it a couple of times. It was so confusing, I just gave up. I mean, it's not easy. So we'll see what's going to happen or take place in the Texas healthcare system exchanges here shortly. Medicaid, originally intended for low income, as I explained before, is meant to be a short-term solution for many. It is the largest means-tested welfare program. It includes the thick file patients. Those are the patients that Dr. Williams sees over at JPS. They have heart disease, congestive heart failure, asthma, diabetes, high blood pressure. A lot of these patients are kind of the worst of the worst. And these are your Medicaid patients. And usually when a doctor comes in, he tries to diagnose you for one condition. Have you noticed that? And you start talking about all this other stuff, and he wants to pull. He says a lot of times they'll say, we need you to come back for that, make another appointment for this other condition. He's only there to diagnose one because he gets paid per office visit, per diagnosis. Medicaid, they can actually diagnose you for multiple conditions, but the reimbursement rate is so low that they got to keep writing them down. So they'll spend a little more time with you on Medicaid, not too much time, because they know how much money they are making and losing based on the time that they spend with you. So again, does that sound like healthcare to you? That doesn't sound like healthcare. That sounds like he's trying to manage a business. You know, I mean, it would be nice if doctors could work for free and afford to live for free. It'd be nice if we all could, but we can't. We need to make money. He needs to pay the bills. He needs to leave the lights on. He needs to be able to run the computer systems in his office. He has to pay the health insurance. You know, a lot of folks used to think that doctors were pretty well off. And, you know, you talk to one and he's saying, yeah, you know, what do you make? Family practice doctor makes, you know, $150,000 to maybe $250,000. Some of them make a little more based on if they have people that are working with them or for them. They may make up to $350,000, $400,000. But that's gross income. That's before they pay their salaries, before they pay their overhead, before they pay their medical insurance and their liability insurance. By the time everything is said and done, they're probably making, you know, not much over $150,000, a lot of them, because of all the costs that they're responsible for incurring as a result of having a healthcare business, being a physician. So let's take a look at what Obamacare does. And it basically raids Medicare to pay for other new programs. And here are the dollars. The health hospital services, payment rates in Medicare Advantage, all of these are going to be impacted as a result of Obamacare. Basically what he did is he said, we're not going to do anything to Medicare, but he just took some of the money from some of the services that were offered by Medicare and he put it in another bucket. And he double counted it. So it looks like there's no change, but there actually is a change. And this is why a lot of the doctors are not going to take any new Medicare patients. I mean Medicaid patients. They just can't do it. Medicare or Medicaid. So they're both going to be impacted by this. Here's the Obamacare cost explosion. Right now, year 2014, estimated gross cost of coverage provisions, $47 billion, going all the way up to $260 billion by 2023. Doesn't look like much of a cost savings, does it? In fact, it's an explosion of cost. And there are going to be penalties that come along with this healthcare system. And I know that we've talked about some of them, but what they did is they did a carrot and stick method. Basically what they said is we're going to reward the doctors up front by giving them bonuses for getting people in the system and meeting certain metrics for healthcare services. But as time goes on, we're going to start penalizing them for not doing certain things. And so essentially what I'm seeing now is that each office I go into, they have to hire a clinical coordinator to manage the healthcare system because nobody understands it. And then they have to have 1 or 2 additional nurses to make sure they're checking off all the boxes for the things they need to meet to qualify for their bonuses at the end of the year. So this is it's a really onerous system the way it's set up. And I think a lot of people are going to fall through the cracks. A lot of people are going to be misdiagnosed. Some people are not going to be treated for certain conditions based on the complaints that they have. But the numbers will look good to the government because, you know, whatever you pay for, whatever you bonus them for, whatever that incentive is, that's what they're going to try to meet, despite everything everything else that needs to be taken care of. So that's what we're going to start seeing in our health care. There's an impact for high earners, income taxes on singles above $200,000. They'll pay a significant portion of the health care costs. For families that make over $250,000, they'll start paying more. There's a 0.9% increase in the Medicare taxes, and there's an individual mandate. It depends on the income, dependent subsidies and penalties to make it work. So there's a lot of taxes that we don't know about that are part of the health care plan. And they didn't tell you about those up front. And then they're in the system, and they're going to start hitting your pocketbook, and they're going to start hitting Walmart and Target and Costco and Benavides. They're going to start hitting their pocketbooks, and guess what's going to happen to the cost of goods and services? They're going to go up. So when you start seeing all those costs of goods and services going up, think Obamacare. That's one. There's also a medical tax device, and we talked about this earlier about, you know, your hip replacement, your knee replacement. Now they're taxing the medical device manufacturers. I know they're in the process of trying to negotiate waiving this tax, but if this tax goes through and impacts the medical device companies, all of your medical devices, all your hips, your knees, those type of operations are going to go up, and they're going to get very expensive because they have to pay those taxes. There's just some numbers on some of the businesses. 62% of businesses employ less than 20 employees. And this is what they're counting on. 90%, 98% of businesses employ less than 500 employees. And they keep throwing this number around and saying that, you know, our health care, Obamacare, is not going to impact that many people. But the numbers show different. 98% are less than 500 employees, so they figure, well, it's not going to have that much of an impact. But, you know, ask Trumka and SEIU, and ask Hewlett Packard, ask Walmart, ask, Lockheed. All these people are starting to lay off and trim their payroll because of the Obamacare tax, and we're going to see more of that. Impact of the Supreme Court ruling. They basically told us that there was no mandate to remove Medicaid funding from the states. Basically what they're saying that there was not, you can't mandate that they have health care. That you cannot mandate it, and you cannot say that there is going to be a tax or a levy on the health care costs as a result of the Supreme Court ruling. It is the law of the land, and they're getting around it by saying that states, they can set up exchanges if they choose, but they're not mandated to do so. And the state of Texas does not have a health care exchange. It's going to be run by the federal government. So the federal government is the one that's administering the program for the state of Texas. And to date, there's roughly 1,200 companies that have received waivers. In fact, the members of the House and Senate also received a waiver, and I keep asking people, well, if it's so good for us, how come it's not good for them? You know, if we're going to abide by the rules that they make, how come they get to exempt themselves from it? And so, what we're seeing is a statist class that is trying to impose their rule of law on their subjects, and we're their subjects, and they're passing laws and exempting themselves from the very laws that they make. And we need to hold these folks accountable. We need to call them to account, and we need to tell them that this is not good. This is not good. We don't want it. We need to repeal it. that fast. There's other tax impacts that I can talk about. I won't go into those right now, just for time. This was a good quote. It's a long one. It was given by somebody that made a concise statement. I believe it was a physician that said, we're going to be gifted with a health care plan we are forced to purchase and find if we don't, which purportedly covers at least 10 million more people without adding a single new doctor, but provide for 16,000 new IRS agents written by a committee whose chairman says he doesn't understand it. Passed by Congress that didn't read it but exempted themselves from it, and signed by a president who smokes, same sentence, with funding administered by Treasury Chief who didn't pay his taxes, for which we would be taxed for 4 years before any benefits take effect by the government, which has already bankrupted Social Security and Medicare, all to be overseen by a Surgeon General who is obese and financed by a country that's broke. That's a good summary statement of this health care law. And then, you know, just some of the other things that were said. You know, Senator Max Bach has said he sees a huge train wreck coming. Senator Bill Nelson, the people are going to suffer, and I want someone to be held accountable. Schumer, insurance rates are going up because of Obamacare. All true statements. And in fact, you know, instead of changing direction and switching gears on this thing, they just doubled down. I mean, it's obvious is staring them in the face that this is going to be a disaster. And instead of changing direction, we just double down. That's either ignorance or stupidity, or maybe both. So you decide. Anyway, in conclusion, the Patient Protection and Affordable Care Act is anything but affordable. It will fundamentally transform the healthcare system in this world, in the United States. It will create chaos at all levels. Less physician choices will be available to you. You will have longer wait times. In fact, you know, if it takes you a month to get an appointment now, it'll probably start taking you about 3-4 months in the next year or so. It's going to take you considerably longer. So if you know you have a condition that you need to be getting reviewed or getting seen for, get in there now while you can, because you may not have much time. And of course, we're going to see fewer U.S. trained physicians. You know, I love foreign physicians. They're good, but they're not as good as the American trained physicians, because a lot of them, their schooling is different. In India, you can go to medical school right after you graduate from high school. Did you know that? Yep. And so, you know, you go in, they got 4 years of medical school, and then they start studying for their boards. And same in Africa, same in China. So you're not getting the rigorous training that the American physicians are getting here. Now, you know, some foreign trained doctors do come here and they do get their training, and they're very good, but a lot of them do not, or have the same training at the equivalent level that the American physicians have. And so what we're going to see is we're going to start seeing nurses, we're going to start seeing nurse practitioners, we're going to start seeing physician assistants providing primary health care services to individuals. You're going to see the doc in the box, you know, the ones that you can call on the weekend, the urgent care facilities, those springing up. And you're just going to see a decline in the overall healthcare system unless some major changes are made. And I'm going to let Dr. Williams come up here and share some information on what he's seeing from a physician standpoint in regards to Obamacare. So thank you guys very much.
All right, I thought Rick did a terrific job, and boy, it's hard to follow that because he said a lot of great things. I do want to just pull up something that read something to you that I just pulled up on my phone, because I've been keeping up with these state exchanges. How many states do you guys anticipate are prepared for October 1? Well, you're a smart group. I can't fool any of you guys. Yeah, none. This is a Reuters story 8 hours ago. And the title of the story is Obamacare Exchanges Seem Headed for a Rocky Enrollment Start. At this moment, not a single state appears to... Change right there. Got to do it for the camera. At this point, not a single state appears to be completely ready, says W. Brett Graham of the Salt Lake City-based consulting firm of Levitt Partners in a testimony to a Republican-controlled oversight committee. He said, states should be capable of providing, quote, baseline functionality when enrollment begins in 3 weeks. But he cautioned about the potential for delays. Most, if not all, exchanges will experience a rocky enrollment period as they work to overcome both known and unknown operational challenges. You can pretty much bet on a rocky start, right? How many people do you think are out there prepared that they even know that there are exchanges that are supposed to be there?
Step on stage.
Oh, you're going to say live? Yeah. All right. Oh, that's what my wife. I need to listen to my wife. She told me to get up on the stage.
Good.
How about right there?
Thank you.
All right. Well, I guess I need my controller here. Just one sec. Okay. All right. So I want to go over a few slides, and I'm just going to go over some information here to help you understand some of the ramifications of this Obamacare law and what it's going to do in terms of the doctor-patient relationship, because it's going to forever change things. This was a quote that was supposedly given to Dr. Benjamin Rush. I don't think it really is, because I'm a big Dr. Rush fan. He was one of the greatest founding fathers there was. He was an abolitionist and the founding father of psychiatry, and I'm a psychiatrist. In fact, we use his image on the American Psychiatric Association letterhead. This doesn't fit what I heard him say, but I love the quote anyway, so you can kind of read the quote. I think what is happening now is that healthcare is going to be something of a real luxury for the wealthy. And you're going to have the haves and have-nots in terms of what's really happening with Obamacare. I thought Rick laid that out perfectly. That's the direction we're headed. Okay, so how about Obamacare's impact on physicians? It's amazing to me. I don't know if you've talked to your doctors about this law, but very few doctors really have a clue as to what to expect. And most of them are in such denial, it is amazing. I'm one of the few docs I know that's actually out here trying to help people to understand the coming disaster that's out there, that's coming. Most docs are just, quote, hoping that everything works out. That's literally what I've heard people say. But no class of Americans will be more negatively impacted than the physicians. Third-party payment arrangements already compromise the independence and integrity of medical professionals. We know that just from what the government has done with Medicare through the Great Society. Physicians will be subject to more government regulation and oversight. And that's you wonder why your doc doesn't spend a lot of time with you sometimes. It's because there's so many forms to fill out, so much information the government wants already. There's going to be a lot of additional information that the government's going to want to know through this law, and I'll go over some of that later. Of course, physicians will be subject to more government regulation and insight, and increasingly dependent on unreliable government reimbursement. Rick did a great job of explaining that, and the reimbursement amount will be going down as well. Usually you get it, but it's late. Maybe that 90-day thing, it could be later than that. But if you get it in late to them, you won't get paid. So it's really going to impact docs' pocketbooks. And I was with a very wealthy friend of mine last night. This guy he's not a millionaire, he's as close as you can get. He said, if I had to go into surgery, I don't want my doctor thinking about how he's going to make his car payment. If you think about it. I mean, this is legit stuff. I want my doctor to be wealthy. I want my doctor to not have worries from the financial standpoint, at least, and that's one less thing that's going to distract him. So, Obamacare's impact on physicians. Again, Medicaid expansion, payment, more bureaucracy, doctor dissatisfaction, and then solutions that I'm just going to talk about a little bit. So I'm going to go over these 4 things. First thing is with Medicaid expansion and decreased payment. Rick went over that. I figured he would, so I left this blank. So it just made it easy for me. Obamacare's impact on physicians, more bureaucracy. This is just an example of some of the stuff that's in this bill. Under Section 6301, Obamacare creates a patient-centered outcomes research institute. Now, that all sounds nice, but what are they going to do with that information? Well, they're going to come up with basically a cookbook. And in this cookbook, it's going to tell would say just the docs, but it's going to really tell the nurses, assistants, the PAs, the physician assistants, and the nurse practitioners, basically how to practice medicine. Now, I work with physician assistants and nurses practitioners. I'm not at Parkland. I used to be. I trained there. I'm over in the Parkland of Tarrant County over at John Peter Smith Hospital, and we have a huge practice over there. We actually see more patients in Parkland in my department in psychiatry. And I work in the psychiatric emergency room. I work with a lot of physician assistants and nurse practitioners, and they have a great role, especially with the volume of patients that we're seeing. And we're dealing with a lot of indigent care. And so, you know, I think there's a real place, but we're talking about this, what I do, working in government medicine, and I do some private practice stuff as well, but the work that I do in government medicine is going to be coming to a physician near you, to a hospital near you. This is going to be the norm for most people, and it's pretty scary stuff. And so they're going to teach these nurse practitioners and physician assistants how to basically, here's a cookbook, do it this way, or you won't get it reimbursed. That's bottom line. Under Section 3403, there will be an independent payment advisory board. You know, I tell you, that is disturbing to me because, you know, as a conservative, and I've been speaking to groups, I guarantee they're going to know me. And so I don't know how much they're going to want to be paying me, depending, because of my views. And we've already got an example of that with the IRS, but I'll go into that later. Under Section 3002, the law extends the physician quality reporting initiative burden with time-consuming compliance and reporting requirements. And so there's just a lot of paperwork, a lot of things to fill out for the physicians. It's going to take a lot of time. In terms of physician dissatisfaction, the American Medical Association's really was one of the big groups that supported this. Now, most physicians are not members of the AMA. I'm not. They represent a small minority of mostly the guys who are the kind of egghead docs they teach. They're not seeing patients. They're basically at the big institutions and doing research. A survey of physicians recently showed that 79% of physicians are less optimistic about the future of medicine. 66% indicated that they would consider dropping out of government healthcare programs, and 53% would consider opting out of insurance altogether. And this is a growing trend. This is going to be the norm. Docs are going to want to have to put the kind of work in and get paid less. And you know, I work with a lot of medical students and residents in training. So you know, a lot of these guys, you know, it's amazing the amount of debt that they've had to go into to get to where they are. You know, you're looking at a couple of $100,000 before you even get out and make a cent. And so there's a tremendous burden on them. And so it's going to be like a train wreck for those guys. And they're going to be basically employees of the government. Obamacare's impact on physicians, doctor dissatisfaction with America already facing a shortage of physicians in the geriatrics and primary care. Many physicians said that they would leave. I know most of the docs my age range, you know, mid-50s and going up, these guys are preparing to exit. They don't want to be around. And personally, I don't know if I want to be around. I mean, I love what I do, but I don't want to have to do it for a living, because making money under this new law is going to be a real challenge. And of course, tort reform is not addressing this, and problems with third-party payers, especially with the government. And so this law really doesn't address those things at all. So scrap it and start over. We need to have a restoration of the traditional doctor-patient relationship, because that's going to deteriorate and become a lot worse.
Yeah, before you kind of go on to this, I just want to ask you a question. We're talking about those different sections, and my concern is, you know, as I'm in the medical field, I have to apply, you know, the HIPAA regulations. My concern is if the government's collecting all this information on me, essentially that doctor-patient relationship is null and void. I don't think the government needs to know what my diagnosis is.
Can I come back to that? Because I know a lot of us.
Yeah, I was going to ask you, would you address that?
I certainly will. I want to come back to it. I dropped a little hint, but I'm definitely going to talk about that.
Okay.
less you can see the rest of that. And we have to get the federal government out of the medicine business. And the biggest problem started back during the Great Society with Lyndon Johnson. And so that it's deteriorated since then with managed care. That's about the time I became a physician in the early 90s. And then this is the final blow in terms of the healthcare system, because this is going to really destroy the quality of the healthcare system. Dr. Ben Carson talked about a solution, and you guys have heard it. I know you guys have. I had the video, but you've already seen it probably anyway. But one of the things he talks about is the health savings accounts, and that's something that really, if we really wanted to, like Rick said, help people who couldn't get access to care, this is the kind of thing that entails, giving them what they need, but also personal responsibility, and that's important.
That's why I mentioned about why aren't the hospitals getting involved in something like that? Since they could be the best healthcare provider, because what, the doctors are there, the nurses are there, the facility is there, everything is there.
Yeah, the American Hospital Association has been working behind the scenes with this Obamacare bill, because I think they, as well as the insurance companies, they see the writing on the wall. But my impression, because you ask yourself, why would these insurance companies be in cahoots with this as well? They haven't really raised a stink about this at all. Why not? You would think they're going to lose a ton of money. They're going to be driven out of business. Well, they know that. They know that. I think these hospitals also know that their days are numbered as well, but they're going to make these deals and make as much money as they can and then bail out. So I don't anticipate that they are really thinking that we're going to try to fight this. We're just going to do the best we can, survive as long as we can, and make what we can. That's my impression. So the fork in the road is near. The fork in the road. So there's going to be two different tracks, basically, for people to get care. Like I mentioned, there's going to be the haves and the have-nots. The track one will be the volume-driven system, which is where I work in. It's the Parkland-type system. The doctor is the apex of the care pyramid, and I'll tell you a little bit about that in a second. And then track two, the service-driven system, where there's concierge-type medicine and direct care models like the doctor in the boxes that Rick had mentioned. So track one, the volume-driven system. You guys, if you haven't been to Parkland, you ought to go check it out. It's an interesting place. Over here in Tarrant County, with JPS on a Friday night, and just bring a lunch, and it's like watching. It's better than TV. Really. It's a bizarre place to do. That's why I love it so. But I wouldn't recommend it though in terms of getting your health care. You see your doctor only on rare occasions in this system if you're very ill. You're usually going to see that nurse practitioner or physician assistant, and then it's volume driven. So they got to see a lot of patients quickly. So they're going to see them in 15-minute slots, and they're going to try to get you in and out, just what Rick was mentioning earlier. Now, in terms of the physician, the doctor's activity is really kind of coordinating things, and they have to be a team lead with the NPs and the PAs. Skill and experience of the physician will be saved for the more complicated cases. We see the worst of the worst where I work, and some very complicated cases. And those are the ones I tend to focus in on. If this is someone with anxiety or panic attack, it's like, y'all can handle that. I don't deal with that. Leadership and management activities. Physicians aren't trained to be good leaders, generally speaking. I think Ben Carson's probably someone who's outside of that norm. But we're not taught people skills and leadership training. And those are more business type things that most physicians aren't good at. I know I wasn't when I came out of medical school or out of residency. Now I've worked on that stuff a lot better, a lot more, and I'm a lot better than I was. Not to say that I've gotten that great, but that's going to be a real challenge for most physicians that you're going to be seeing in that system. So it's going to be really disorganized is what I'm trying to get to. Because most doctors aren't good at those kind of leadership skills. Now track two is going to be service driven. It'll be great for the patient. As the shortage of physicians continues, it's going to be, did you mention the physician shortage coming? Because they're talking about by 2020, we're going to have a shortage of about 91,000 physicians. I mean, just really a tremendous number. And then of course we're adding more people into the system. So people are going to be willing to pay to be able to get out of that first system I told you about. And it's going to cost some money. You know, I think at some point it might level off where it's almost somewhat reasonable, but that's going to be in addition to whatever you do with the government exchange situation. Because you still got to, you know, pay your toll to the government, right? And then this will be something in addition that you're going to pay to see a physician. And as a patient, you'll continue to see your doctor, you know, whenever you're ill or for routine care. How many of you have a doctor that you see routinely that you have a good relationship with? You know, that's going to become a thing of the past for a lot of folks. And a lot of docs are going to go to this, well, some docs are going to go to this concierge care model. Some docs are just lost. They don't know what they're going to do. The vast majority of the docs I've talked to have no clue how they're going to prepare. They're not preparing for it at all. The doctor we saw the other day, he's not prepared at all. I'm looking at him like, dude, you're gonna be swallowed up. Doctors most likely would be practicing solo in small offices and have much more time available for visits, so it'll be, again, great for the patient. Now, in terms of the physicians in this service-driven system, again, the absence of business training, specifically marketing training, is going to really hurt a lot of docs. They're not going to know how to set up these exchanges because you have to make, you know, direct relationships with your customers and set up these deals, how much you're going to pay on a yearly basis or a monthly basis, whatever, so you can have access to seeing a doc. You know, it'll be something like maybe you pay $1,500, $2,000 a year, and you'll get access to 2 visits a year, and then phone calls or something like that. Who knows how it's going to be set up? And I've heard different concierge models out there, but you know, this is going to be something in addition, again, to the taxes that are going on out there and all these exchanges and the penalties that you have to pay. Here the physician is often seeing less than 15 patients a day, so it's great, again, for the doc. And it's dramatically lower overhead. So there will be some docs that will go in this direction. Now, we talked about the IRS. So, you know, I think most of you know all this stuff. IRS is an important cog in this whole thing. Of course, you know, with regard to the IRS, in addition, there are executive orders that are steadily amending this Obamacare law. You know, Rick talked about that, and I know one of the things that disturbed me was after the Sandy Hook shootings, President Obama had these executive orders that physicians are going to ask every patient about guns. I don't know if y'all heard about that.
Yeah.
Now, I'm a psychiatrist, so I deal with people who are homicidal and suicidal. I ask about guns all the time, but I don't ask every patient. If somebody comes in for a panic attack or obsessive compulsive disorder, I'm not going to really go into, well, gee, you have a gun and you're planning on shooting somebody. It's not part of that history if it's not pertinent. If somebody comes in, the cops have them in handcuffs and they just try to, you know, shoot somebody, well, that's a hint. How many more guns do you have? I need to go into detail on that. But they're talking about your family practice doc, your OB-GYN, your regular docs, asking every patient, do you own guns? And to be honest, I think a lot of physicians will do it because they're going to feel the need to report somebody with guns, or they're going to be, you know, black marked or something. Something bad is going to happen because, I mean, the IRS is over this thing. As we talked about government access to medical records, and then this Sarah Hall Ingram, who's going to be over the Obamacare, over the whole entire implementation of this thing. These are frightening things. I think it's important that you talk to your individual doc and that you lay out some ground rules about what you're going to tell them and what you're going to tolerate and not tolerate. Because I don't know a lot of docs I know are rather conservative, but they're kind of wimpy conservatives, and so they don't want to buck the system.
Do you see the medical field, doctors and nurses becoming totally state-controlled by the government, being the government paying their salary,
Yes.
controlling their salary?
Absolutely. That's where it's headed. I don't think it's going to initially be that way, but in 5 years, I think it'll be a different world. I think you'll be pretty much there. Yeah, so I anticipate that a lot of physicians are going to comply with every part of this healthcare law. And they're going to be asking not just about guns, but a lot of other stuff that's really totally personal to you, and that should not be part of that particular exam.
last night, and the lady told me that a friend of hers told her that she had gone to a gynecologist earlier that day, and that the gynecologist had about 40 sheets of paper for her to fill out. All kinds of personal questions, things like when's the last time you have sex, who you have sex with, you know, do you prefer men or women, do you like both? You know, all kinds of stuff that has nothing to do with her getting a medical exam in a gynecologist's office. And I mean, I would expect that those type of questions are going to be more commonplace, unfortunately. And one person asked the question, well, do we have an answer to the question? Of course you don't. Just like, I mean, as an individual citizen, you can take a stand and say, I'm not going to answer those questions. Of course, you might be a little bit of blowback, but you have to deal with that. I'm not going to answer those questions. It's not their business.
Thanks, Gene. Ma'am, was there something else you wanted to mention or address? Did you want me to address with regard to all this?
Just about the, you know, the privacy that you're gonna have or not have, a lack thereof.
Yeah, you know, it's funny because it's almost like a lot of this Obamacare law is the exact opposite of HIPAA. And it's almost you have to
Yeah,
violate HIPAA
absolutely.
to, you know, fulfill the Obamacare law. You know, I think it goes back to our core values in terms of being healthcare providers and what we know is right and what we know is wrong. Some of us are going to have to take stands that are not going to be popular and very well make us into trouble with the government or with someone. I anticipate.
Yeah, they were supposed to certify the system, the electronic system, to make sure that it afforded the firewalls to protect your privacy. And during their last review of the system, nothing was set up. So they're saying that we're going to put everybody in this system, we're going to start putting all their data into this electronic system, but there's no way we can guarantee that no one else is going to be able to access the system. And I think what's going to happen is, day one, information is going to start getting sent out on specific individuals, you know, your movie stars, your, you know, senators, lawyers, doctors, and it's going to become an issue. But right now, they're trying to sweep it under the rug and make it seem like it's not an issue. But it was supposed to be certified before the healthcare exchanges went into effect October 1st, and it hasn't to date.
Well, because I've already seen, you know, our particular insurance company, if you come into the office and we'll do a blood pressure check and we'll check your cholesterol for you here in the office, I'm like, wait a minute, that's between me and my physician. You should have, it's none of your business. But we'll give you a discount.
Yeah.
We'll give you a break on your insurance. And it's like, yeah, but you're violating HIPAA because it's not my employer's business what my cholesterol is.
I've heard several stories like that, yes. And I think that's what
I mean,
that's
it's a
becoming
clear
a trend.
violation of the HIPAA Act.
Yeah, I agree. But I think right now, with the political climate, HIPAA is almost secondary to this bill, to Obamacare. And it doesn't make logic at all. I mean, I think it's just politics. And again, speaking of politics, with the IRS in charge of this, and we know about their targeting in the past, I guess none of us in this room are going to feel real secure about this, because I mean, if there's information out there about you that you don't want to have known, they're going to have access to it. Yes.
Oh, you got it.
Yeah, I just wanted to just ask real quick about the doctors that opt out of the system. So it's going to create a whole kind of market for people that don't want to pay these kind of doctors. Maybe in that kind of system, things will get a little better. I don't know, get less expensive, or how do you see that?
Well, I think you're going to always have good docs out there. There's going to be some that will, again, set up these concierge or direct care facilities, but it's going to cost. I anticipate it's going to be really expensive initially. In addition, you're going to have some other docs out there who are maybe going to give some quote discount kind of rates that I wouldn't necessarily think are going to be the best docs out there. So that's disconcerting as well. So I mean, it's going but it's gonna cause really create a two-tiered system where you got the haves and the have-nots. The people who can afford to get the best docs are gonna go be able to get them. This is not gonna affect the people in Washington who passed this bill, and the wealthy people who back this kind of thing. So it's really kind of scary what's going to happen to the mainstream population. It's going to be where you see mostly non-physicians. So protecting yourself against Obamacare, if this thing continues to roll through, which is a frightening concept in itself, there's some things you need to think about. You know, and that's of course unconstitutional. I mean, the president can't amend a bill that's been passed by Congress, and yet that has been allowed to go on. And again, the Republican Party has made no stink about that. But I think, like, beyond not being able to be clairvoyant and read the future, you have to know that there's a storm coming. You may not know what the storm's going to be like, but it's just good to know the storm is on its way. Many of these docs, they intellectually know it's coming, but they don't want to deal with it. They're in complete denial. I'm a psychiatrist. I deal with denial every day for a living. And I'm telling you, this is amazing, the amount of denial psychiatrists are in, physicians are in. And you see it, Rick. It's incredible. I mean, it's like they're in a dream world. And this is going to, at least when the bad comes, I wouldn't have expected it. and I've got my plan B's, you know, set up outside of medicine, because to me, you got to have something else if you're a physician, because this is going to destroy the American healthcare system. So that was my comment with regard to that, and there's some resources here. You know, I think the biggest thing we can do is to pass on the knowledge we have. You guys know a lot more than your docs. Pass on the information you have, not just to them, but to the community. We've got to let people know that a big storm is coming. And we've already, you know, inflation is already expected, but with this bill, and with what Rick was saying, in addition to what's going to happen with the patient-doctor relationship, you know, this is really going to be a real mess. So I wish I could give you a more rosy picture, but I think we need to make sure we push our elected representatives to block this health care bill, to not fund it, because otherwise this is just going to be horrible, guys. Yes, sir.
I think you just shared with your document, and it's from the Federal Reserve System. It's from the Federal Reserve System, in which Billy is a retiree. Basically, it's moving him from a premium plan to a standard plan. Although the standard plan only went up by $5 copay for practitioner, his deductible out-of-pocket maximum used to be $1,000 for the premium plan for individual, $2,000 for the family. What has gone up under the standard plan is now $3,000 deductible for the individual, an increase of $2,000 a year, and for the family, it's gone up from $2,000 to $6,000. So although his premium may be reduced, his actual deductible has now more than doubled. What amazes me is that this is the Federal Reserve System. And what also amazes me is just what he said. I went to a doctor to see my physician personally. He's 70, I believe he's 78 years old. He told me he wants to retire, and I can understand why. His replacements are, and no offense against any nurse whatsoever, is a family practitioner registered nurse. The other one is a PhD and also is a, I guess, chartered financial nurse that can practice as well and prescribe prescriptions. My question comes down, do they have the same degree of education? Do they have the same degree of experience? They're good people. But I feel like I'm getting less bang for the buck, less experience in diagnosing a situation. My question is, yeah, Obamacare may have passed, and just like the doctor said, that the one way I know of to stop this thing is to stop the funding of it. If we can't get it done by a vote, then notify your congressperson, male or female, and let them know what the costs are doing. This is from the Federal Reserve Bank of Dallas, 2200 North Pearl Street, Dallas, Texas. My question is, I don't know how much plainer it can become than in writing. My concern now is, after having spent 12 years with the Department of Treasury, is I know my premiums are going up. They were when I retired. I took them early out at about $250 a month. They're now $800 per month. So the question comes down, when do we finally wake up? And when do we finally voice our opinion to Ted Cruz's, John Cornyn, and other House of Representatives, including the entire Congress, to say, you know what? We don't buy it. We have a problem. If your income's going up when you get over 65, let me know, would you? Because it's sure not going up $3,000 or $4,000 a year.
Has anyone seen John Cornyn, by the way? I'm going to go buy a milk cart and see if he's on there.
He's missing. Is he missing?
Missing that?
Yeah, missing.
Yes, ma'am.
While driving over here, I was listening to talk radio, and I heard an interview with Senator Lee from, where is it? Mike Lee. From what state?
Utah.
Utah, that's right, thank you. And he was saying that it is his understanding that what the House is about to do, they are going to do a vote that does two things at the same time. It defunds Obamacare with one portion, and with the other portion, it's a vote to fund all of the government, including Obamacare. And they're purposely trying to disguise and hide it from the American people, to not stand up for what they're really voting for. So we really need to talk to our House representatives and tell them no for this vote that both funds and defunds Obamacare at the same time.
Thank you, ma'am. I just kind of want to follow up on that. I guess here, our local congressman, we're in Eddie Bernice Johnson district, so that's probably a lost cause. But our Republican neighbor to the north, Pete Sessions, a group that I'm a part of called Activists for Truth and Liberty, we went and sought out Pete at a closed door meeting in Rowlett, and we interviewed him on why he does not support Ted Cruz's plan to defund Obamacare. And he said a lot of the same thing, you know, just like trying to say that it would shut down government, and he hasn't had the language from Ted Cruz, even though it's been available for a month and a half to the public. And so, you know, we got him on video for about 3 minutes, you know, explaining all these things. And we sent out the video, and last night redstate.com did a video where I did a write-up on it, and they went and just debunked all of his claims, like one by one. So if anybody wants to make an impact, I would say try to call Pete Sessions, because he's one of the most powerful congressmen in the States. So yeah, just want to share that.
Yeah, that video, we'll send out that link to you if you're on our mailing list. If you're not on our email list, be sure and see Nathaniel Nas in the back, and you can sign up. Make sure we have the email address, and we'll forward that link out so you can. Activistfortruth.com is the